Hello everyone, we are going to look at how we are going to suture. It is the suturing technique rather than the suture types. Just to have stressless suturing, you need to make sure that you have a clean flap. And the clean flap means a flap that you designed very well with a clean incision with no tissue tags. Making sure that when you designed it you knew how you're going to close it. For example, this flap here has a large distal relieving incision. This is for demonstration purposes only. If this is in real patient's mouth and you're near the tuberosity here distally and the patient hasn't got a wide mouth opening, then you're going to struggle suturing this part. So if you're going to do something like this, you probably will have to have this vertical incision slightly, or relieving incision slightly short, so that you don't need to suture back there, you just need to suture the corner. In any case, this is not the purpose of this this demonstration, but a clean, nicely designed flap is your key to good closure. Now, the most important thing is the approach. Your needle has to be approaching the flap at the area where you want to start your suturing at right angle. So imagine that you need to stab someone. I'm not saying that this is the case, but if you need to stab with a knife, you need the end of the knife or the tip of the knife to be at right angles to where you want to stab, or else the edge of the knife, if it's not sharp enough, it won't actually cut properly, it will tear rather than go through. So the other thing is you need a tissue forceps that is really good with very thin beaks and easy to handle. This one I like very much, and it hasn't got teeth. It's not tooth, it's serrated, and when it's serrated it holds the tissue but without the danger of tearing it if you're pulling on the tissue a little bit. So anyway, you hold the tissue with your tissue forceps like so, right? Okay, just under the area where you want to start your suturing. Right angle, right? Push in, and then once you've pushed in, right, turn the needle around along its curve, right? So just along its curve so that you can get the needle to come out where you want it to. Okay, now you can actually hold it with your tissue forceps like so, right, and very gently pull it through. If you can't, then just give it a little push at the end of it, right, so that it comes out quite easily like that. And when you pull, just put your needle holder on the thread like that while you're pulling, so that you don't pull the flap like this, right, which may, if the thread is quite long, as it's going through it may be cutting the tissue and it may tear it. So put this like that, then you can keep the mobile part of the flap very stable while you're pulling the thread like so. Okay, leave the short end like that. The long end I like to leave it on the patient, right? So if you've got the patient drape or a tray on the drape where you put your instruments, then put it there. The reason behind that is you don't start the knot when you're knotting, right, outside the patient's mouth. Okay, right? So don't do that. Anyway, the second stab wound, right? Okay, where we're going to put the next bit of the needle, next puncture wound, sorry, to complete the suture. This is a simple interrupted suture. Now what you do is you need to know where you want to pull that corner towards. If you pull it that way, if you put this here, there's a danger that this will pull away from the incision, or there is a danger that these are going to overlap. If you tie it a little bit hard, which you shouldn't really, this may the tissue may sink in a little bit and then creating a little step here, which will create a scar, or maybe the healing may be sluggish. Okay, so what you do is just put the needle through and then perpendicular again, and make it slightly facing slightly distally, right? Again, you're going to pull this and you're going to do that. This here, what I'm doing here, it just stops it from tangling up, right? Okay, and there you go. All right, so this is one, this is number two. Then put the needle and the long end of the thread on the patient, as we said, and then we're going to start tying the knot. Tying the knot, you can do it in 3, 2, 1, which is 3 over, 2 under, and 1 over. Or you can do it, I like to do it 2, 1, and 1, right? Okay, whichever the way you do it, it has to be a stable knot, right? So you start here, not too far, right? So 1, 2, 3, so that's 3, okay, right? So 3 here, right? Get that. Sorry, let's see, right? And then just push this slightly over so that you can pull the thread through the loops that you've made, so that it doesn't tangle up. Okay, just like that. Okay. Okay, so pull this right through like that, and you can actually ask the nurse to put an instrument, right, on the knot, right? Okay. I'm just doing it mirror image, so it is just for the demonstration purposes slightly difficult to do it on the model like that. So there you go. So this here, the knot, right, the first knot. Okay, all right, and make sure that the knot is away from the incision line. All right, and then so that's 3 over, right, and then 2 under, 1, 2, right. Again, pull this through like that, 2 under, and then 1 over. Right, the knot is on the buccal side, the flap, this side of the flap is being pulled that way, right? Okay, and the knot is nice and stable, right? Now we hold both ends of the suture together and present them to the nurse to cut. Okay, when you cut, don't cut too short. Leave about 3-4 millimeters sometimes, so that the knot does not get undone. Okay, so you hold it to the nurse like so and present it to the nurse to cut. Okay, and that concludes the technique of suturing and the tips to get a stable suture. Thank you very much.